Hello, I'm Lori Waken with Grace Care, Personal Care and In-Home Services. We've been coming to you over the past few weeks to visit a little bit with individuals and agencies about programs and services and opportunities here locally that are of particular interest to our seniors. And today we have Julie Nelson from Hospice Circle of Love, and she's going to talk to us a little bit about hospice services and what all that involves and just some things that we may not have known or understood about hospice. So welcome, Julie.
Thank you.
Thanks for coming in today to talk to us.
Yes,
and
glad to be here.
Yeah, we'll just jump right in and tell us a little bit about hospice. People, I think, have an idea that they know what hospice is, but maybe they don't fully understand. So if you could just give us a little overview, that'd be great.
Okay. Well, hospice cares for people who are terminally ill, and generally it's someone who has 6 months or less to live if their disease followed its normal progress. We really focus on quality of life. So we want to help patients and their families make every day count. We have a variety of services that come into their home or their nursing home if that's their home, and help them with physical, emotional, and spiritual support.
Great. Now, how do these clients come to you? Do they call on their own, or does someone send them to you, or how does that work?
Well, anyone can make a hospice referral. A lot of our referrals come from the patient's doctor, but we have had people call and say they needed hospice for themselves.
Okay.
Or their family member might call them. The nursing home or the hospital might call us. It just depends on who kind of sees that need. It could come from anyone, though.
Okay, so there's not any kind of guideline or rule. If you think you might be interested or want more information, you can just give it a call.
We just need to have a doctor sign off on that before we start services.
Okay, and you can help someone coordinate that, I imagine.
Certainly.
Awesome. Okay, and how is that paid for? I imagine it's not free. Like anything, there's going to be a charge. So how is that covered and handled?
Well, hospice is a Medicare benefit.
Okay, great.
And so we get paid by Medicare. If the person doesn't have Medicare but they have insurance, we can bill their insurance company. Otherwise, we take care of them at no charge. We're a not-for-profit, and so we don't ever charge the patients or their families for our services. Specifically Hospice Circle of Love, I don't know how other hospices take care of that, but it is a Medicare benefit no matter which hospice you use.
Wonderful. Okay, and just to clarify, Julie is with Hospice Circle of Love here locally, and there are other hospice agencies, and so we're visiting kind of about hospice services in general, but Julie will be talking from the perspective of her familiar background with Hospice Circle of Love. And so if you are interested in hospice services but might like to call around or ask some other agencies how they work and how they operate, you're more than welcome to do that. So just wanted to make sure and clarify that. You did mention, Julie, that the services that you provide are typically for 6 months. If a person's disease ran its course, it would be about a 6 month or less time frame. What happens if somebody comes in with you and they're doing better and it progresses well beyond that? Are there any kind of consequences? Do you have to delay service? How does that work?
Well, we don't ever kick anybody off services because they go past the 6 months. We've had patients for up to 2 years.
Okay.
However, Medicare requires that they show a bit of a decline over time. So if they improve and aren't showing a decline, then we do have to take them off services.
Okay. But I imagine if they began declining again, that they're free to start back up again, and wonderful. Now, when you say quality of life, talk a little bit about that. How do you help enhance someone's quality of life through your services?
Okay, well, there are a variety of ways. Probably the primary thing is that we're managing their pain and their symptoms.
Great.
So the nurse is helping with that, in their own home. They're surrounded by their family, their things, with their loved ones. We have a social worker that can help them with lots of different issues, financial or caregiver needs. Maybe they have a loved one who's serving in the military that they want to talk to. She can help coordinate that.
Great.
She can help them sign up for veterans benefits or get a handicap placard for their family vehicle.
Great.
Lots of things like that. And then we provide spiritual support through our chaplain services. If they're interested in that, it's kind of supplemental support to your own minister or pastor. And they can come in and visit with the person, read the Bible, pray, whatever it is that they would like.
Great.
We have different therapies we can provide. We have pet therapists. We have a music therapist.
I'll bet those are popular.
Yes, and there have been a lot of benefits that have been shown from those. We also have volunteers who can provide companionship to patients,
Right.
as well as provide respite for their caregivers.
That is very important, isn't
It
it?
is.
Actually ran into a volunteer out in the hallway while we were waiting to come in, and
That's right.
she was talking very glowingly about her experience in volunteering with hospice. And I would like to visit a little bit more about that, but I did want to touch on, again, you had mentioned your social worker and coordinating services and care, and I imagine when someone comes into to your service, you know, they're at a position in their life where they or their family members, for whatever reason, whether it's physical weakness or maybe mental emotional weakness, or just being overwhelmed with all of the emotional aspects of what they're going through with their experience, that there are a lot of things that they really could use some assistance with as far as direction, locating resources and communicating. And do your social workers help line up things like end of life, you know, planning, or that kind of thing, coordinating the next steps?
They can help with funeral planning, do not resuscitate orders, a
Great.
variety of things.
Great. Help line up all of the appropriate paperwork and get their advanced directives in order and that kind of
Yes.
thing. Very important. What are some of the largest needs that you see when you go in and start services with a family or a client? I imagine that there are some typical things that you see through your experience that folks are dealing with where you all can step in and be of benefit.
Probably the biggest one is pain management.
Okay.
You know, if someone has cancer or any other kind of end-stage disease, they're probably dealing with some pain issues.
Right.
And our nurses know a lot about pain management.
Right.
They work closely with their doctor
Okay.
and try to get that just right. And they know what types of pain medications work best with different types of pain. So that's a big one because you're going to have a lot higher quality of life if you're not in pain.
Absolutely. And what about nutrition? I know we have a lot of clients at Grace Care who may not be at end of life but are struggling with some decline in health and just some general aging types of things. And nutrition a lot of times is one of the first things that falls short. And do you all do some counseling or help with that?
We have a dietitian
Wonderful.
that can work with the families on that.
Great. Wonderful. Volunteers. I was visiting with you a little bit earlier and we were talking about some of your volunteer opportunities, and I'd love to have you share a little bit about that with us as well. I know there are lots of folks out there that might be looking for a place to plug in the community, and this might be right up their alley. So.
Okay. Well, Medicare actually requires hospices to utilize volunteers for at least 5% of their direct care. And we always exceed that. We have a great group of volunteers. We have over 30 volunteers.
Wonderful.
And they do things like provide companionship for the patients. You know, they'll go visit them once a week in the nursing home, maybe bring them a special treat, visit with them, read to them, those kinds
That can
of
make a huge
things.
difference,
Oh,
can't it?
yes.
Just to have a visitor and something to look forward to.
Yes. And then if the person's in their own home, a lot of times they're also providing respite for that caregiver that's there 24/7. That way they can have a break. And so that really helps the family out quite a bit.
Great. Now, are your volunteers trained? Do they have to go through some sort of a training program?
Medicare requires us to train the volunteers, and I'm sure we would want to anyway to make sure they
Absolutely.
understand exactly what hospice is all about and what our organization is all about and what all they'd be doing. Our volunteers also help us out some in the office, and they help with our fundraisers that we do throughout the year.
Good. What is a typical, if you could write a recipe or a menu for a typical great hospice caregiver, what were would be some things that they would exhibit as far as their character and personality and that kind of thing?
Well, they're always someone of high compassion.
Of course.
The kind of person that can put themselves in other shoes.
Empathy.
Yes, a lot of them have good communication skills, you know. A lot of them have experience maybe having cared for a loved one that was terminally ill, or some other type of experience with hospice or
And that
caring
does
for
help
someone.
them to be able to relate, doesn't it? A lot of times when you're going through a situation like that, I know you really, it helps to have someone who's been through something similar. You just feel more at ease there. You mentioned fundraisers. Tell us about these fundraisers that you have.
Well, we do our book sales a couple times a year, and we'll have
Heard of
one.
those.
Yes, we'll have one in October. And people from the community bring us books throughout the year, And we've been doing it a long time, so I think they just know that we do that, and
Right.
we
Look
get them
forward to it.
Yeah, most days we get a donation of books.
I've
and
walked out with bags of books myself over the years. So
we have thousands of them, and we categorize them.
wonderful.
And the hardbacks are $1, and the paperbacks are 50 cents.
Very
and so that's a
affordable.
very good
Well, and
fundraiser
then
for us.
read them, bring them back, resell them.
That's right.
Great. It's a cycle. And what else? What other fundraisers do you offer?
We do a clay shoot in the fall.
Okay.
We do that at Cimarron Junction over by Ringwood.
Oh, fun. Is there a pretty good turnout for that?
Yeah, we had our best year last year.
Wonderful.
And so that's a lot of fun. And then we have a Kentucky Derby party in May. And probably our biggest event is our Tree of Life celebration.
Okay, tell me a little bit about that. You've mentioned that earlier and I'm intrigued.
Okay. Well, this is what we do in December. Around Christmas time, people begin to miss that loved one,
Yeah.
you know, that they've lost. And we set up a series of Christmas trees, and we'll put ornaments on there with loved ones' names. And all the patients that we've served in the last year, we'll go ahead and put those on automatically.
Okay, be honored on your tree for the year.
And then anyone else from the community can purchase an ornament with their loved one's name. And it doesn't have to be someone we served, it can be anyone in the community.
Okay.
And that's a $25 tax deductible donation.
Uh-huh.
And then we have a ceremony where we read all of the names on the tree. We always have some Christmas music and a short spiritual message, and then we have a cookie and punch reception.
Oh, that's lovely. I'm sure that's very appreciated, especially from those that have recently lost a loved one.
I think it is.
I want to ask you too, I have participated a little bit in your grief support group, and I know that you have some services that you offer to families once their loved one has passed. And could you tell us a little bit about that?
Okay. Well, bereavement is a large part of what we do because we deal with so much death. We do follow the families for at least a year after the death. We send them cards on significant holidays. We call them. If they're having a lot of trouble, our counselor can meet with them,
Great.
which is a big help. We have a series of booklets on grieving that we can send out to families if that will help them. And then, of course, our Tree of Life ceremony is one of the things we do. And then we have these grief groups throughout the year. There's one going on right now. It's usually for 4 weeks. And it's a group setting so that you're there with other people who are going through a similar thing. And so it's for anyone 18 and over who is grieving, and they don't have to have been served through us.
Right.
And the next one will be coming up in October.
Well, and I can say from experience, like I've said, that it is a very helpful, beneficial, supportive, non-threatening group to participate in, and is very helpful. I recommend that to anyone who has struggled with a loss, whether it was recent or even a while ago. It can just be very helpful to be around other people and talk about or just listen. You don't even have to talk about it if you don't feel comfortable. So wonderful service that you all provide. In closing, are there any maybe misconceptions about hospice care or the hospice program as a whole, the philosophy that you would like to address to the public before we close?
Just one of the things you hear is that people think they're giving up when they go on hospice.
Yeah.
But really you're not. We focus on, like I said, quality of life, and there have actually been studies that have shown that people who are on hospice live about a month longer than someone that doesn't go on hospice with the same terminal illness. It's because you're getting all of that quality one-on-one care.
Right, and I imagine the pain management and nutritional help and just some relief of some of the stress and burden.
Yeah, and the other thing is I want people to know that if they did decide to pursue aggressive treatment after they'd gone on hospice, they can always go off of hospice.
Great, so you're not locked into
Right.
a decision. You don't have to be bedridden or
You don't
in
have to be
severe.
homebound to be on hospice.
Wonderful. Well, unfortunately, we are running out of time, but I know there is a lot of information about hospice that can be of benefit to a lot of folks. And so if you have any questions, please don't hesitate to call Julie at Hospice Circle of Love or any of the other hospice agencies here locally in Enid or in your area. If you have questions about any issues on aging, elder care programs or opportunities for seniors in Enid, or home care, please call Grace Care. Call me at Grace Care at 580-237-6911, or you can email me at Lori@gracecareok.com or visit our website. Thanks a lot.